There's been a call for, actually, the Federal Ministry of Health, aims to establish the National Health Facility Regulatory Agency to create and enforce national health facility standards, not just healthcare provision now, but health facility standards, ensuring clinics and hospitals across Nigeria meet basic safety and service benchmarks. Sometimes the challenge is not whether or not we have these facilities. Sometimes the challenge is how they are maintained over time. In the news this morning, you may have seen over the past few hours on Channels Television, the Minister of Health, at the federal level, commissioning this cancer treatment or cancer maintenance facilities in like 1 or 2 states of the nation. And the questions abound as to, again, maintenance of these standards and everything else. But we have here with us Dr. Richardson Ajayi, who has been actually talking about this thing because, according to him, this regulatory gap is fueling quackery, brain drain, and eroding public trust in the healthcare system. Thanks for joining us this morning, Dr.
Thank you for inviting me.
Is this an afterthought on our part? We're, what, how many years old now, and we're just talking about establishing this facility, this agency?
Well, I think, healthcare has been here forever. Doctors go to medical school and they set up their thing and they start to provide a service, and some do it at different levels. But the thought to organize a system is just coming. So the Nigerian Health Act was passed into law in 2014, and that Health Act really provides the framework for the healthcare system for Nigeria. In that act, one of the key clauses is the need for every healthcare facility to have a certificate of standards to be sure that you are meeting the needs of the populace. Now, that has not been implemented because you need a body to be able to drive that. The same Health Act states that tertiary health institutions in Nigeria will be managed by a national body, Tertiary Health Institution Standards Committee, but non-tertiary healthcare facilities are to be managed by the State Ministry of Health. Now, that brings a challenge because that requires resources. Now, 2 states, which is Lagos State and Yobe State, Lagos State has set up HEFAMA, Yobe State has set up YOFIMA, the only 2 states that are really focused on bringing those agencies to bear to say, listen, let's organize the health facilities in our states. So the objective of the federal ministry by setting up Nigeria Health Facility Regulation Agency is to have a national framework. And I have the privilege of chairing the committee that was tasked to birth this committee. And what we are looking at is, having a national body that supports the states in developing their states' regulatory framework. At least we'll have a national standards that all states can refer to. Because you see, what currently happens is that a doctor qualifies as you get your qualification as a doctor.
To practice.
To practice. But you can practice anywhere you decide. So you can rent a house, you can rent a flat, you can say this is a hospital. And in order to maximize your earnings, you start doing more than perhaps you should.
Okay.
I mean, I work in the fertility field, the Bridge Clinic, and what we've seen is because the demand for fertility services is such that everybody is setting up IVF clinics.
Okay. However, there is, of course, you are not unaware of the opposition to this initiative. Johisu, for instance, has publicly rejected the plan, and they have called for the immediate suspension. According to them, the initiative violates the 2024 MOU with government, and it contradicts the National Health Act of 2014. the Pharmaceutical Society of Nigeria has also raised concerns that the agency would undermine the independent authority of the Pharmacy Council of Nigeria. How are you taking this on board?
Well, I don't see how it will infringe on the Pharmaceutical Society. I mean, the Pharmaceutical Society regulates pharmacies, pharmacists, and pharmacies. What we're talking about is the health facilities where you have one or more registered medical practitioners who are providing a service. Now, the way we've set up, looking at setting up NEFRA, is not to infringe on any established structures, but to actually support established structures. So I think the pharmacies, Johesu, everybody has a vested interest in protecting their own interests, and we can understand that. But the important thing is that the nation, this is the missing jigsaw, missing piece in the healthcare jigsaw of Nigeria. We all know how the banking industry has been transformed with regulation, as has telecoms, as has pensions, as has insurance. So without this regulatory oversight, we will continue with the challenges of healthcare. I mean, why do we have brain drain? Brain drain, one of the reasons is we don't have a national structure for remuneration and compensation for doctors. Every facility does what it likes. But with the Health Facility Regulation Agency, we can define what that should be. And not every doctor should have a hospital, because we can also drive collaboration. Because what we see, what we need in terms of hospitals are investment vehicles where you can drive collaboration and have 40, 50 doctors working in the same hospital. Then that hospital is robust enough to be able to generate the kind of revenue that it needs to generate, to provide sustainable income for everybody working there. So I really believe we need to work together. Yes, I'm aware of what Johesu and the Pharmaceutical Council has said, but I think they're looking at it from a very narrow perspective. What is necessary is this oversight, and we can't change healthcare. Even look at National Health Insurance Scheme, the struggles we're having in terms of having insurance penetration. I believe one of the problems is that we don't know how much healthcare costs to deliver.
Perhaps maybe it's a challenge of available information. For instance, one of the pushback that Johesu and PSN are having, in fact, there's also another association, the Assembly of Healthcare Professionals, saying that they believe that strengthening current frameworks under the National Health Act of 2014 might be a safer, more collaborative path.
Yeah, I mean, I agree with them, but how? What is the structure that is going to do that? That is why you need a National Healthcare Facility Regulation Agency, because that agency is that structure. Yeah, everybody can collaborate. I think NEFRA is not trying to use up the rights of any established agencies, but we just know this is what is missing in healthcare today. You see, a doctor is regulated by the Medical and Dental Council, and they do a fantastic job in licensing doctors. But there's nobody that licenses facilities across the country. So that licensed doctor, how do you know that the infrastructure that he has deployed is adequate enough to provide effective care, to provide safe care for patients, to provide responsiveness to the patients? So this is focusing on the patients, not on the professions, because there's nobody that we need to say, if you're going to say you're doing renal transplants, then you need to have this level of infrastructure to do your renal transplants, and we need to know that these kind of outcomes are being generated. Otherwise, we're not protecting the patients. Similarly, there are many people that are providing services that, if you look at outcomes, they really should not be providing those services. So it's all about the level of infrastructure you deploy, your quality management systems, how you train your staff, All of this is critical.
How about, what's the NMA, for instance, the Nigerian Medical Association, what are they saying about this initiative? Because it will be important for from what we can see here, even the NMA is neither here nor there. As far as they are concerned, they are emphasizing that the solution lies in strengthening existing laws, just like Johiso and APA are saying.
Well, I think the NMA, fortunately, the committee that we have members of the NMA in our establishment committee, and so I believe the support is there. But the real issue is we've evolved something that works for certain people, and those certain people maybe have a vested interest in maintaining the status quo. But the truth is, the nation, Nigeria, we're hemorrhaging healthcare dollars and medical tourism. We're losing all our staff that have been trained. So our healthcare system is not really developing as much as it should. Insurance penetration is low. If you look at a lot of our national statistics, including maternal mortality, we have one of the highest in the world. All of this is because we don't have an integrated framework for regulating healthcare. I spent a lot of time working in the UK. You can't deliver a baby anywhere, okay? For you to get a license to do maternity care, that building that you call your maternity hospital must have a blood bank in it. It must have an emergency operating theater that can be activated within 7 minutes. It must have a neonatal intensive care unit, so that if a baby is born that needs resuscitation, it's there. It must have an intensive care unit, so that if the mother is sick, you can resuscitate the mother. It must have accommodation for your obstetrician, your anesthetist, and a neonatologist. Now, all of this must be put together and seated in that place for you to do emergency obstetrics. Now, until we start to put these kind of systems in place, we'll continue to lose mothers.
So is this, these are the things that you're proposing that this agency will perform?
These are the kind of things the agency will look at. Just, I mean, what is a hospital?
Until now, my apologies, until now, who has been performing these functions?
These functions are performed by doctors deciding what infrastructure they deploy.
The practitioners themselves.
The practitioners, but in Lagos State, we have EFAMA, and EFAMA is increasingly doing a good job in creating this regulation. But EFAMA is new. But hitherto, before that, doctors decided what it is they're going to do. And unless you put a system in place that's, okay, fine, you want to provide obstetric care, we'll give you a license. We go on and inspect, we know you're safe, patients, we give this place a stamp of approval. You can go here, you can take money to provide this service. I think we're talking about human beings.
Okay, so the federal government is initiating this, and you are the one leading the charge. Yes. How about the states? What kind of conversations are you having with the state governments?
Well, we have some state health commissioners on the committee to really support the idea and give us an idea of how best to engage the subnational structure. It's very clear that NEFRA has to be set up like a consulting structure. So, we don't have NEFRA will not have the power, according to the Health Act, to go into a state and regulate facilities. But we can support the state regulatory structure. So basically, NEFRA will help every state in the federation set up their own health facility regulation agencies. And rather than having to reinvent the wheel, we will have national standards that everybody can refer to. So I think that's NEFRA's role, to really support each state to develop these structures and then develop national standards that everybody can refer to.
How serious or how important or impactful is this initiative on medical tourism, on the standard of healthcare delivery in the country today?
Currently, quality ethics sits with individual doctors. So if a doctor is good and the patients trust, they'll keep coming. NEFRA's vision is to embed quality and ethics in the system. And once quality and ethics is embedded in the system, it will build trust within the system. And if you build trust within the system, of course, fewer people will travel. At the moment, people don't know where to go. There's no reference point beyond word of mouth recommendation. So I've been to this doctor, he's good. But what is the definition of his good? His good is not his patience, it's not his ability to smile at you. It depends on his outcomes. And if nobody's measuring his outcomes, I mean, when I came back to Nigeria, there were people doing, I'm an infertility guy. There are people doing IVF. And when you hear what patients are going through, the man is very popular, patients love him, but he's cheating patients because he's not actually providing the service. But they love him because he's a nice guy. But that's not healthcare. There's an asymmetry of information between the doctor and the patient. Patients more or less don't know what they're buying. But if you have a system that codifies this, which inspects the doctors occasionally, ensures they've deployed the right facilities for the services that they've provided, check their outcomes, and give the patients that assurance that this system is working, then you're going to build trust. Fewer people will travel, and we start to develop our healthcare infrastructure in Nigeria.
Now, we have to also find a way to build that trust among healthcare service providers across the spectrum. Because if an association of healthcare professionals are having a pushback, Johesu is having a pushback, then that begs the question of whether or not they themselves understand the need.
Yes, I think that's one of the key elements of our setup is stakeholder engagement. There's a need to really sit in the same room with Johesu and everybody, the Pharmaceutical Council, and really reassure everyone that we're all on the same side. And that side is making sure we provide a secure infrastructure to provide healthcare for Nigerians. At the moment, we've not had that opportunity. I was surprised about the opposition because for me, this is a no-brainer. This is something that is very obvious. But once we started getting these letters on opposition, it was important that we have to engage all stakeholders so that we all understand that we're all on the same side.
So for how long has your committee been working?
Oh, we had our initial mandate was for 6 months. At the end of the 6 months, we had to submit our report to the ministry, including started the process of getting a bill passed for NEFRA. And I'm pleased to say the bill has had its first reading in the House. But it's a long journey. But I think the objective of this kind of engagement is sensitization, allowing people to understand that this is important and it's not something that there are no vested interests. All we want to do is make sure healthcare works for Nigeria.
Okay.
And that's an important thing, yeah.
Now, you earlier said that, one of the things that you said was that as far as you're concerned, we should find a way to push against quackery. You said this regulatory gap of healthcare facilities is fueling quackery, brain drain, and it is eroding public trust in the healthcare system. Speak to the quackery part that you talked about. Is there any data, even if it is speculative data, about the level of quackery as a result of this gap?
I think it's difficult to give you data, but I think there are many anecdotes where you have healthcare facilities providing services where people are not licensed. Where not only are they not licensed, you don't have the equipment to provide the service that you're taking money from patients for. So that's all quackery. And unfortunately, the anecdotes are all over. There are many, many cases of stories that's going on. So we have to define what a hospital is in Nigeria. We don't have that current definition. By that, I mean a hospital is not where you take patients or where a doctor lives. A hospital must deploy a certain level of infrastructure. For example, there are some hospitals where there are daycare services, which must be different from a place where patients can spend 24 hours. The amount of infrastructure and investments must differ. There's a need to look at, in the banks, for example, we know how serious our banks are now. They increase the share capital. We need to have that kind of consideration in healthcare as well. Before you get a license for a hospital, there's a certain kind of infrastructure you must deploy. And I must make a very big distinction that we must differentiate a hospital from a doctor's practice. A doctor can do what he likes in terms of seeing patients safely because it's consultation. Doesn't need much infrastructure. But when you're starting to operate on patients, when you're starting to do more sophisticated equipment, then we have to have a definition for the facility that you can do that in, and that is where the conversation really begins.
Is there a chance that this agency, this initiative is being resisted because it's likely to inform the shutting down of some facilities?
Absolutely. I think that's part of the concern, but then we have to drive collaboration. The fact that we shut down some facilities doesn't mean you're going to be out of pocket. Is how do we coalesce everything? I mean, I'm driving here to your to channels this morning. I drove down the road when we came up the expressway. I was surprised among the hospitals on that road, the diagnostic centers. I think it's a highly populated area. But why are they hospitals? What equipment do they have? That's what it's all about. Maybe you need one hospital in this area where all the doctors with their individual hospital all work together. And then they can all put money and make sure they have all the right infrastructure.
Okay.
So I think that's a big issue, and I think thank you for raising that point.
You know, but another thing is, you know, because I asked the other time who's been doing all this work, and he says the doctors. So perhaps, you know, there's also that suggestion that's been coming from several quarters, Johisu, APA, and the rest of them, including the PCN, talking about strengthening existing bodies like the Medical and Dental Council, the PCN, NAFDAC, and maybe some state health ministries without creating a new agency. What would that be like?
Well, I think I understand where they come. There are actually a lot of regulatory structures in healthcare. Which you mentioned some of them. I mean, there's the Medical and Dental Council, there's the Midwifery Council, there's NAFDAC, there's the Standards Organization of Nigeria looking at equipment. Now, all of these are focused on the professions, apart from maybe NAFDAC, which is not looking at drugs. But nobody is protecting the patient, okay? Nobody is saying, you know, what do the patients need? The Nigerian Bill of Rights is out there to do that. But patients receive service through facilities. So there's no regulatory structure that defines healthcare facilities in Nigeria. So we believe that this agency, once it's formed, will be an integrator of all the different regulatory areas. Okay. Now, not trying to infringe or usurp the rights of any existing structures, but actually coordinating the activity and looking at the patient and say, listen, are we providing safe, effective, responsive care to our patients? Okay.
Please decrypt healthcare facility. When you say healthcare facility, are you just talking about the building? When you decrypt it so that at least maybe that will also help people understand what you're talking about.
A healthcare facility is a building where 2 or more registered healthcare providers work. Now, you have some facilities that are designed for daycare. You have some facilities that are designed for overnight care. You have some facilities that are designed to do operations of different levels. So all of this will need to be defined and codified and say, you know, this is a primary care clinic. This is the level of equipment they must have. This is a hospital that can do operations. The theater must look like this. The beds must look like this. The corridors must be this wide. You must have a lift to take patients up. There are hospitals today renowned hospitals where patients are operated on downstairs and they haul them upstairs on a stretcher. That's not allowed in 2025. Because and then if you're going to have a lift, you must have the power infrastructure to maintain your lift. Okay? Now, all of this is not our investment vehicles. So the change is that the concept of a doctor building a hospital, which is what we have in Nigeria, will change. That is part of the resistance that we have to deal with. But that comes with engagement. And Rome was not built in a day. So the idea is not, let's close everything down. No, let's start a journey. And that journey may take 10 years. Okay? So the idea is not to close anything down, but they say, let us design the kind of system that we believe will serve Nigerians. And so it's an evolution, not a revolution.
Okay, I'm waiting. Because this that you just mentioned that, in my head, I'm just seeing so many hospitals.
But whether we like it or not, we have to start the journey.
Okay, so there's this, you said something the other time about, you know, this quackery thing. Of course, many Nigerians fear quackery. But then, many Nigerians are also wary of another agency, another government agency. So how do we bridge that trust gap between the health system and the public? Okay, another agency, oh, we have this, we have this, we have that, and then this again. How do we bridge that the trust gap?
I think it's through dialogue and engagement. You know, the concept of NEFRA seems to be a disruptor, you know, to most people's minds. But I think the key is just to engage. I said I belong to the IVF field, of which there's an association called AFRH that all IVF clinics are supposed to report their results to say that these are the clinics, this is the kind of results they're doing well. I think there are over 100 clinics, but only 15 submit their results.
See what I'm saying? This is why you have a pushback, Dr. Ajayi.
But that is the point. Patients need to procure services. Where should they go? Should they go to these places that are not providing their results, or should they go to the places where the results are being provided? So that's what I'm saying. This is, you know, our healthcare is very professionally focused. Let's focus on the patients. They are the ones who are working with their healthcare dollars on medical tourism. Billions are living in the country on an annual basis. So let's integrate and focus on the patients and say, what is it that we need to do to ensure that the patients are served? It's not just that the profession serves itself. So it's good. I mean, I don't expect it to be an easy conversation, but I think it's a conversation that must be had.
Absolutely. Thank you so much for your time this morning. We can only wish you the best because you are definitely up against some gods.
I know.
Dr. Richardson Ajayi, founder of Bridge Clinic, co-founder of Pathcare, and also coordinating chairman, should I say?
Yes.
Of the National Healthcare Facility Regulatory Agency that the federal government is thinking about. We appreciate your time again this morning.
Thank you very much for the invitation.
Okay.